Hi class of 2028, this is the instructional video for PRO 822 lab session number 2. What are the lab goals for the specific sessions? What you will be doing. Make alginate impressions of the maxillary arch of your mannequin. Pour alginate impression in microstone to fabricate maxillary diagnostic cast. Trim and adjust the maxillary diagnostic cast for custom tray fabrication. Last session, you received your edentulous mannequin. You'll be needing this for the session and many others. If you haven't done so by now, make sure you read the edentulous mannequin user's manual for proper handling and storage of this mannequin. You'll also receive a 3D printed maxillary tray. This tray needed to be fabricated for this course due to the modified nature of your mannequin. Other market available trays did not fit or adapt well to the edentulous mannequin, so this tray is specific to this preclinical course. It's not a requirement or necessary to be requested clinically. What's available in the clinic? You'll have metal stock trays. You'll modified metal edentulous trays with rope wax to better adapt to your patient's anatomy. For this course, you'll be using the 3D printed stock tray shown previously. So what you will need to bring and have available for this session. Alginate packets and microstone will actually be available to you, but you'll need to have your green rubber bowls, mixing spatulas, measuring cups and or cylinder, your whip mix stone vacuum mixing bowls, and mix in the boxing wax. One thing you have to remember that for all of the lab assignments that is a simulation of a clinical procedure, you'll need to have your PP on. So that means your eye protection, masks, and gloves. You'll also need to be providing that care or providing that clinical procedure on the simulator with your mannequin attached. And as needed, you may need your saliva ejector or HVE. So this is a video of how you should be mixing and applying alginate to your maxillary tray. Here I have poured in the stone, and you'll notice that my mixing cup has a little bit less water. It's on the top of the letters on our mixing cup. You'll add the water to your bowl and start mixing. First, you incorporate the powder into the water. Make sure it's homogeneous as possible. And then at this point, you're going to start pressing your spatula against the green rubber bowl. You're going to have to do this multiple times until you have a cream mix of alginate. So here I'm actually avoiding bubbles to be created within the mix, and it should be as creamy as possible. So this is a regular time setting of alginate, so you don't need to be working too fast, so you have some time here. You're going to grab all that alginate from the side of the bowls and put everything in your spatula. Get your tray. You're going to slide all of that alginate in one movement towards your tray. Make sure you're applying some pressure so it fills in completely, and some of that extra alginate will stay on your other hand. You're going to need that in just a minute. So as you noticed on the video, the water line is a little less than the ideal, right? What is actually recommended. And the line is a little above the word, so it says full pouch, and the water line is a little bit above that. So what actually happens at a higher powder to water ratio? So the setting time is faster. It does set a little bit faster. So you will have to work a little bit faster when you're mixing, but it's still pretty good timing for you to mix your powder and your water properly without setting on you while you're mixing. It does have a higher viscosity. Why is this important when you're making alginate impressions of edentulous patients? You don't have teeth. You're going to have to apply some pressure to the soft tissue while you're doing that. When you have an alginate impression material that is too flowable, you're going to lose all of that. So you want your alginate material to be a little bit more viscous. It does increase hardness and tear strength. You won't need to be so easy to take out your tray from an edentulous patient. So it's okay that it's a little bit more hard. So yes, the impression becomes a little bit more brittle and it's less flexible, but it should be fine for an edentulous case. So there's no issues or no concerns of reducing some of that water in your measuring cup, okay? It's fine. Now, this is the part that's going to be a little messy. I always advise students to let your patient know what to expect during this time, okay? So remember that extra alginate that you placed on your left hand when you were mixing alginate and applying it to your tray? You're actually going to need it now. So you'll be using that extra alginate to fill in the vestibule, and you're going to have to apply some pressure while you do this. If you don't, you're going to create voids within the alginate, and you're going to have to retake your alginate impression. So fill in the vestibule, apply a little bit of pressure all around. With your loaded tray, you'll first position the tray posteriorly and work your way to the interior portion. Once you've done that, make sure you apply pressure vertically towards the palate and support your fingers bilaterally on the tray. This way, you'll distribute those forces equally both on right and left side. If you don't apply this pressure, you won't capture the vestibule properly. This is how your alginate should look like. You may need to trim some of your alginate impression for better pouring, so make sure you use your buffalo knife or your 25 blade to do that. Properly mixed alginate has zero to minimal presence of bubbles or voids. The area in green are areas that voids equal to or less than 2 are okay to have, but the palate area should be as intact as possible with 0 to some bubbles, but it's less than 1 millimeter is okay in this area. Make sure you're capturing the hilar notches of your patient. You'll need to wrap your alginate impression with one boxing wax sheet. Mold it so that you are able to shape it as close as possible to the alginate impression and with minimal openings. It's okay if you have some openings. Once you've done that, you'll have to remove the boxing wax as a whole unit as it was shaped. This is because the first part of pouring, the impression will need to occur without the wax. It becomes very cumbersome with the wax in place. You'll mix the microstone using the whip mix vacuum mixing bowl, and take your impression without the boxing wax to the vibrator and start pouring. Use the lowest vibration as possible to avoid creating bubbles in the stone. Pour the microstone, and yes, it will run towards the palate. Keep it at an angle to avoid that as much as possible. Once the entire layer of the alginate has been filled with stone, you'll place back your boxing wax, and outside of the vibrator, you'll add the remaining stone to fill it up to the top. You're able to tap on the bench for this second part to make sure the stone is seating properly. Play the video again. This is just that first layer. So as you can see, it runs towards the palate. Normal. Just make sure you have that first layer of stone over the alginate, place your boxing wax, and then add the remaining wax on the bench. This is what it will look like once you have filled the stone all the way to the top of the boxing wax. Yes, some stone may have run to the sides, and that's okay. Once the stone has lost its shine, remove the boxing wax. If you leave the boxing wax, the exothermic effect of the stone will start melting that wax, and it will be very hard to remove that wax afterwards. So do it now. Once the stone has cooled completely, meaning it's cool to touch, trim the excess stone and alginate around and inside of the tray and clean that area as much as possible. You can use a buffalo knife or a 25 blade to do this part. This will help you remove the tray much faster and clean. This is an issue if you try to flip over your edentulous impression with the stone. It will create large distortions, sometimes even voids, and it just won't work. So avoid doing this type of pouring of your edentulous alginate impressions. Once you have removed the tray, this is what it will look like. Rough edges, potentially an angled base, and even some sharp edges. You'll take the diagnostic cast to the model trimmer to make sure you still have around 8 to 10 millimeters in thickness of your cast, especially in the posterior portion, maybe not so much on the interior, and that's okay. And that you have corrected the anterior, posterior, and lateral angles of the diagnostic cast. So this is what it should look like. As you remember previously in our lecture, we need to respect the vibrating line. Our vibrating line in the edentulous mannequin is posterior to the Nissen brand mark. You should trim your cast to where you cut the numbers in half, as you see in this image, giving you some room to adapt your tray properly and see the posterior part of the Nissen brand. You'll notice that the edges of your cast are sharp, as I mentioned previously. You'll soften these by using an acrylic burr to make a small land area, which is actually that flat surface that you see the acrylic burr creating. This procedure is very particular, and you need to avoid touching the burr on your edentulous ridge, so be careful not to nick your ridge. Positive and negative blebs, voids, bubbles, they're normal. If they are equal to or less than 2 millimeters, they can stay. Positives will need to be removed with a Hollenbach carver. Do not worry about rugged area, small bubbles. You'll actually be adding wax to this area later, so don't worry. As I mentioned previously, make sure you capture properly without distortion the Hamler notches. Avoid trimming excessively in these areas. This is what your diagnostic cast should look like at the end. It must have the following: absence of positives and negative voids. It's okay if it's less than 2 millimeters. Make sure that you are carving out those positives so they're not in your way when you're fabricating your tray. You must have a small land area, so equal to or less than 2 millimeters. Your height of your land area. So as you see here, I trimmed so I can actually see the entire vestibule properly. Some of you may end up cutting or even trimming, over trimming where the frenum location is. It's okay if you're over trim, especially in the land area, as long as the frenum is still intact and you can see it. So that way you can actually fabricate the custom tray properly. So it's okay if you, let me see if I can put my laser point here. So let's say you over trim this and this land area here is below the level of your frenum. It's okay if you do that, as long as when you're taking your diagnostic cast to the model trimmer, you don't cut completely the frenum. You want to make sure you still see the entire frenum so you can properly make your tray. The height of the land area should be equal to or less than 2. This is because we need to see the vestibule completely when we're fabricating the custom tray. So the thickness of your diagnostic cast posteriorly, this area should be around 8 to 10. So the angle anterior posteriorly, the ridges of your diagnostic cast should be parallel to the horizon, right? So this angle between your edentulous ridge and your base plate, they should be parallel to the horizon, all right? When is it due? Your diagnostic cast for the maxillary arch is due Thursday, August 14, 2025. All right, get to work.